I think for me, there were three take home points from Dr. Flano's presentation. Number one, I'm glad you made a friend and somebody who protects you. Uh, but number two thing, and remind you that in the back we have the fire and rescue from Birmingham, and they have information about radon detectors. Because even though we know about lung cancer and smoking, remember the number two cause is what? Radon. And how many of us are getting detection? And we know that Birmingham has a high concentration of radon in many of our homes. So please, if you don't have radon detection, see the guys back here. And number three, and this is a great segue for our next presentation, is talking about special populations. And in this case, we're talking about veterans and lung health. Our next speaker is, and also I'll point out later on, we're going to have someone else talking about stigma associated with smoking. Our next speaker is Ms. Sasha Smith, excuse me, Dr. Sasha Smith. Dr. Smith is a very well-versed individual in lung health and particularly lung cancer in the veterans community. She will address the unique needs of the veteran community, the historical risk factors that they face, and the services that are available to them. Dr. Smith.
Hello, everyone. How are y'all doing today? It is a pleasure to be here to share about veteran health. Do we have any veterans that are here in the audience today? Yes, yes, yes. Thank you all so much for your service. Hold on. Do I need to stand up? Okay. All right. Okay. Thank you all so much for your service and the sacrifice and commitment that you made to this country. It does not go unnoticed. So, lung cancer screening amongst the veteran population. Am I going in the right direction? Yes. Okay. All right. So, for the veteran population. So, as we've talked about, lung cancer screening, lung cancer is the number one killer of all cancers. So, you see a lot of pink in October. You also see that from the top of the month to the end of the month, but no one talks about the number one, which happens to be lung cancer. So, according to the American Cancer Society, greater than 200,000 cases every year, about half of those cancers end up in death. Number one, and 90% of that, of course, we've been reiterating, is associated with smoking. Now, we also talk, our other speakers also mentioned what the qualifications are. So amongst our veteran population, it is the same. It's associated with the United States Preventative Service Task Force. So we call it USPSTF. So long acronym. So you have to be 50 to 80 years old, have a 20-pack year smoking history or more, and we'll talk about that. No prior history of lung cancer, and you have to be healthy enough for treatment. So what does that mean about being healthy enough for treatment? That goes to the other section on the other side that says hold off. So if you have any other specific cancers, or if you have any comorbidities, meaning other things that will prevent you from being able to go through surgery, but that can be determined by your physician, then you would be excluded from screening. It doesn't mean that you cannot get the same scan, but just this particular service. So, within the federal system, we have a way to identify those veterans. So, you can come and ask, like, hey, do I qualify for lung cancer screening? But we already have a system in place to be able to identify that age group. So, it flags a group that I just talked about, 50 to 80 years old. It catches current smokers. And then also, if you are on the cusp, let's say that you have an 18-pack year history, we have a system that's going to keep up with that to make sure once you reach that threshold, we can still identify you to bring you in for that screening. So what is a pack year? I believe our physicians touched on that earlier. So there are 20 cigarettes in one pack, and then it goes to the years smoked. So let's say that you smoked one pack a day for 20 years. That multiplication is 20 pack years, and 31, 22, same goes for that. So, breaking the stigma and shame amongst our veterans associated with lung cancer screening. When you went into the service, they gave you your fatigues, they said, let's go, and they gave you a carton of cigarettes. So, a carton of cigarettes is quite a large number. But at that time, no one knew the implications associated with giving you those cigarettes. They were told, hey, they're going to help keep you calm, they're going to help you in combat. And so there was an association of it bringing you some type of relief during that stressful service. So, others shame, it's my own fault. It is not your fault. As we talked about nicotine and how addictive it is, also as addictive as cocaine and heroin, it was specially formalized so you to keep smoking the cigarette. So that's why they put so many in one pack, because they knew the time it would take before you would need nicotine again. Also, the VA offers smoking cessation to all of the veterans. So they have quit programs. They have a clinical pharmacy referral to be able to take you through those quit programs once you feel that you are ready or you're thinking about it, and especially after today. So, for our minority population, for us, we were targeted on purpose to issue these cigarettes. We were told, like I just said, that it would provide relief, it would provide calm, and then also the menthol that was associated for a smoother inhalation, so it wouldn't be as rough on you and your lungs, and it would be more appealing. So it also takes a heavier toll on that, but the physician before spoke about that. So what we want to emphasize here is that the federal system has created a way for you to take back control so that we can undo the harm that was done and offer a way for you to quit and get out. So if you see here, your body starts to heal right away once you put it down. Within the next 20 minutes of you quitting smoking, your heart returns to normal. 12 hours, your oxygen rises and carbon monoxide clears. Within 2 to 3 weeks, you have better circulation and breathing. 1 to 9 months, your coughing eases up. 1 year, your heart disease risk is cut in half. And 5 to 15 years, stroke and cancer is decreased. So with the screening, you're eligible based on the United States Preventive Service Task Force that I just said. But after you have quit more than 15 years, you're no longer eligible because your lungs actually begin to heal themselves when they are no longer exposed to cigarette smoke. Now, that does not mean, like I said earlier, that you cannot still get the same type of scan, which is called a low-dose CT scan that we do, but it just means you won't have to have that annual scan because you are at decreased risk. So, when you decrease your risk of developing cancer as well as decreasing your smoking, you have more time to be with your children, be with your grandchildren. You have more time to explore some of the things that the federal system may offer to you as far as health care is concerned. You can make better decisions associated with clearing the smog that may be associated with that. And you can leave a healthier legacy and teach the next people that you see that you may have been smoking in the car with or they were smoking with you. So there are counseling methods that are available. The federal system provides support, and there is a quit line especially dedicated to veterans that you can call. So if you're starting on a quit journey, they have that line that you can call, and they'll help walk you through those things if you feel that you have to pick up another cigarette again. So early detection is key. What you see here is a low-dose CT machine. And so it's not necessarily like an MRI. And it does not take long. And early stages of disease, early detection decreases your rate of possibility of developing lung cancer. So with the federal system, it is free for all of our veterans who qualify. So I know that cost is associated with some reasons why people don't seek what it is that they need, but it is a free service that's offered. And then also the stigma associated with not liking going to the physician. We want to make sure that we break those stigmas. Of course, there's history associated with why our population may or may not trust physicians or trust something called clinical trials. But there have been things put in place so that we can make sure that everything is followed the way that it needs to so you can get the care that you need to receive. So also we say, well, just pray. Just pray about it. Yes, you can pray. And you can believe as well, but you have to put forth the work and make sure that you're making those steps towards getting a healthier future. So, as I mentioned earlier, we see a lot of pink in October, but the red ribbons that you see down there, Lung Cancer Screening Awareness Month is in October. And so every October, there are programs that are put on within the federal system to bring awareness, to bring screening, and to educate our veterans on how they can better take care of themselves and how we can help take care of you. So, thank you so much for this time here. I appreciate it, and you all have a blessed day.
Sasha, appreciate your comments. And, many of us have veterans in our families, if we ourselves aren't. So please be sure and go home and remind them that these opportunities are available. Our next speakers are going to be talking about something that's a little bit, may seem like it's a little different and not necessarily directly related to healthcare, but I assure you that it is the cutting edge of what's happening as far as healthcare delivery is concerned. We will next be addressing the role of AI, or artificial intelligence, in modern healthcare. Whether we realize it or not, AI has gained greater importance in the evaluation, diagnosis, and development of treatment protocols. It is important that we all have some familiarity, because we've already talked about the important role of patients in being participants in their own healthcare, not just simply laying back passively being, passive recipients, but being actively involved in what's going on. And therefore, I think it's important that we understand all the factors, just as much as we heard about getting x-rays and then talking to a doctor. Well, how are certain algorithms being used to determine how we're going to be cared for? And we're fortunate to have two speakers who are fairly expert at what they're doing with this, and Dr. Sandeep Bodduluri and Ms. Kelly Powell. Dr. Bodduluri is an assistant professor in pulmonary and critical care medicine and is the director of the AI Center for Lung Analytics and Imaging Research at UAB, University of Alabama, Birmingham. Ms. Kelly Powell is program director, too, at the Mamix E. Hersink Institute for Biomedical Innovation at the UAB Medical School. They will discuss how is AI being used in our overall healthcare continuum. Please, docs, come on up.
Hi all. Thank you so much for having us here today. We're so excited to be here and to talk about AI and this different topic. So I'll let Dr. Bodduluri introduce himself, but my name is Kelly Powell. A lot of what, trying to stay away from the speaker? Okay, okay, gotcha. A lot of what we do is we do a lot of different topics within AI medicine, and I was so excited to talk to you about some of those different things today. So I did want to touch on a couple of things. So hearing Miss Morales and her story, and from hearing you talk about your own story, and I have a very personal connection to my own mom. So hearing you tell your story, it was almost like hearing my own mom tell her own story about it. So these types of events are our favorite things to come and talk at, because a lot of our speaking opportunities are usually with clinicians, but this actually gives us a chance to talk to our own community about how your own healthcare journey is being navigated. So finding it early changes everything. I think that is the theme of today. And one thing that I'm not going to spend a whole lot of time on is really going deeper into that, because I know that we have talked a lot on that topic. So I am an engineer, but I am not a big fan of numbers, so I'm not going to spend a whole lot of time on that. But one thing that has been brought up over and over again is this one statistic here, the 65% 5-year survival when found early versus found late. So that is one thing to take into account when thinking about how important early screening is. Okay, again, going back to the numbers conversation. So I know that these numbers have been gone over a few times in regards to CT scans and early detection. This number right here, trying to stay away from the speaker, 872,000 life years that could be gained by reaching everyone. So let that sink in for just a moment about how big that number actually is, okay? So if we're able to increase who is having access to these scans and early detection, that is such a big number to take into account. Okay, this low-dose CT scan. So this has been brought up a few times with our other speakers, excuse me. So one thing I do want to highlight with this low-dose CT scan is it is needleless, okay? So I don't know how many people in this room are afraid of needles. I know I hate them and typically pass out when I'm around them. So I try to avoid them at all costs. So the great thing about a low-dose CT scan is there's no dyes, there's no needles. So it is quick, it is painless. So I know that it can be, when taking into account any sort of fear that's associated with your healthcare. So I don't want that to be something that you're thinking about in terms of your own care. Okay, so going back to numbers. We had talked about these numbers a lot with some of the other speakers, but these are, if you fall within this, these parameters here, so between the ages of 50 to 80 years old, 20 plus pack year smoking history, and then the 15 years of quitting, or if you're still smoking, right? So you are going to be eligible for these scans. So please keep that in mind. Okay, how far AI has come. So does anybody feel like AI is like a little bit sci-fi? Like feeling like you're living in the future a little bit and unsure about really where it's going? Does anyone fall into that category? Yes. Okay, so our goal today is to try to take some of that sci-fi mystery out of what AI is. I'm sorry, Sandeep, I'm gonna pass it to you in just a second. Okay, so what AI actually is. So who likes doing puzzles? Okay, awesome. So when you do a puzzle, what do? You typically do the edge first.
I'm going to stay back.
Is it you? I'm trying to figure out, sorry. So you do the edges first, typically, right? And then you're looking at the pieces and you're trying to identify which colors go where. Maybe you might group colors in a certain capacity, right? In a certain group, maybe you might do the edges first. Maybe you look at the shapes. You're trying to figure out which piece goes where, right? The more that you do puzzles and complete puzzles, the better you get, right? So this is called pattern recognition. And AI models do the exact same thing. I'm going to pass it over to Dr. Bodduluri.
Good afternoon, everybody. Good to see all of you. And my first time being here, it's been a pleasure listening to all the esteemed speakers. You can think of me as your kid or a grandkid who fix your phone, because I'm an engineer walking into a room full of physicians every day and trying to tell them what AI would do and how AI would help. This is the first time the opportunity I get to talk to the patients, talk to the community as well in terms of understanding what AI is, where AI is getting used right now within the healthcare.
I can go up there.
Yeah, you can come here.
Okay.
So you can think of AI as, is it being used? Yes. At very levels in healthcare, especially for the lung cancer screening. When you go take a CT scan, once you get the scan, that gets passed to the radiologist, and radiologist during their time reads the image and says, hey, I see a tumor, I see a nodule. They send the report back to your physician, and the physician calls you back saying, hey, we found something, we want you to come back. For that entire process to happen, it can take up to 2 months to a year, depending on appointment, scheduling, and everything. Where does AI come in? Irrespective, I'll talk about the dangers that comes with, the risks that comes with AI, but where AI comes in is shortening the time frame. When a scan gets taken, we have algorithms from companies or from our internal within UAB or any other health system, they can automatically detect and tell the radiologist, hey, I do see something here. You might want to take another look, or it fastens their process overall. So the time for you to get care for early detection shortens with the using of AI, because what AI has been done is it has given 1 million lungs of all the patients across the nation, across the worldwide, and it recognized, okay, lung cancer tumor looks like this, skin cancer looks like this, it just how we learn as kids, right? As the more information we get, the better we become. That's pretty much what we're trying to mimic with AI as well. So AI in healthcare is such a crucial thing where we have to remember that it is so powerful, we cannot not have it anymore in healthcare because everybody started to use it in multiple levels. I'll talk about some of those things. You might think about, how many of you know here Chat GPT? Yeah, I see some. That's good. That's good. So Chat GPT is pretty much how you ask a question and it'll tell you an answer, irrespective of whether it knows or not. So some of these AI models that you interact with or you're going to interact with in the future, these are all trained not to say no. They're never going to say no to you. They're also trained to not to say they don't know. So that's the risk with it. So the reason why when we use AI, especially for the healthcare decisions or healthcare decision making or the clinical decisions, you always need to go back and talk to your physician, put the human in the loop, do not just believe what AI gives you when you're talking about understanding the disease better, understanding your care process better. So these models have become really powerful, but always keep that in mind. These models are trained to say, never trained to say, I don't know. So AI is much across the cancer care. We've gone from just looking at images, using AI for images to detect cancers to when you walk into a clinic now, the physician might ask you saying, hey, I have this AI tool. I'm going to record all my conversations with you in this visit. And they're going to record the entire visit. And that conversation will automatically comes up as a report that you can take home or the doctor can submit into the health system. So they don't have to spend time after their work hours to be able to write these reports for every patient. Before they go home, the AI can actually optimize that entire process for you. So what does that mean? That means a physician will have more time with the patient, not worry about the notes they have to write after going home or before they're going home. That also means they see more patients in a single hour when you start incorporating some of these AI tools in there. So next time I'm sure if you're into UAB, if you're coming to UAB, one of the physicians will definitely ask, hey, I have this tool, I'm going to record all the conversations when you walk into a visit, when you go to a physician. It's powerful, and it also helps engage the physician with you much better overall as well. So as I said, AI is already helping today. The amount of, we say that the age of AI is 2 weeks. Whatever I tell you now, after 2 weeks, everything changes. That's how fast things are changing right now in AI. Every day, every company coming up with new things, changing everything. So what does it mean for healthcare? What does it mean for medicine? We cannot, nobody cannot, physicians cannot, patients cannot, the regulators, FDA cannot approve devices every 2 weeks just because a new model came in. But you can see the change here. For the until 2023, we had only 600 FDA-approved AI devices for care. From 2023 to now, we have 1,000. Just from last 3 years, I'm not even talking about, so we have now close to 1,600 FDA authorized. That means when you go take a scan, that scan is already using AI in the background. So it's already been approved. Not everything will be reported to the patient, but it is already in your workflow. AI is already being used one way or the other for the cancer detection to the biopsy, biomarker detection overall. So from a patient perspective or from a clinical perspective, you can think about, AI can tell you find who to screen. You have a lot of data, a lot of scans that comes from each for the hospital. We can put an AI on it and say, hey, I think based upon how the image looks, based upon how their entire history looks, you might need to pick up the phone and call this patient because they need to come back. You don't have to wait for the radiologist to read it in 6 months down the line. So this is what we're using AI for, to able to reach communities faster, able to reach the patients faster and get the care faster to them. And we can also predict the risk. There is a great study that came in a couple of years back. This is for a breast cancer survivor. The patient came in, I think 2022, and AI said, they took the image, they took the CT scan, sorry, mammography, and the AI said like, hey, I think this patient might have cancer. And it sent a report to the physician. And the physician said like, I don't see anything in the image. So there is no point of me mentioning that to the patient because it's just going to scare them away, saying if there is nothing in the screening. What do a physician do in that point? So the physician said like, okay, they did not say anything to the patient because AI said it. They did not say anything to the patient because they actually verified it and said they didn't see anything in it. The same patient came back after 6 months. And the AI said, hey, I think at this specific region, we think there is cancer. That's what AI said. Again, the physician team got together and said, like, we are not seeing anything. And after 6 months, this is all the journey of 18 months. At the 18th month timeline, they started to see a nodule develop at the same area AI was telling them 1 year back. So you see how useful in the healthcare setting, if you're able to catch that, at least to verify through a biopsy or something like that, if the AI said something like a secondary diagnosis. So that's what we're trying to do as engineers, trying to convince physicians. I think there is something here because this model or this AI model has seen so much of images of so many different patients, so many different diverse groups. So we believe this would help your workflow. But we never say, we never say that believe in AI all the time. We say, make your informed decision, but this is what AI thinks. But the ultimate captain is always the physician. The physician and the team has to make a change. So that's what AI has been used for, especially in the lung cancer settings as well. So closing the gap, one record at a time. AI can read your records. How many of you get records, take your records home and don't understand what's exactly in that paper? Me too. Because I'm not a physician. I don't know anything about what's happening with my body. Until then, I have to pick up my phone, call my PCP, and say, hey, what is going on? What is his language? When do I even take the medication? But we are building tools. AI can help you in the patient education side as well. AI, you can take that, search for some of these things. So we have a tool that we're developing within UAB right now where we provide explain, we call it as ELI 5, meaning explain like I'm a 5-year-old. So whenever somebody gets a patient record, it goes through this tool saying, explaining them like they're 5-year-old, what exactly you have, what you need to do, when do you need to take the medication, and it's completely written as a 5-year-old reading a storybook. So we're using AI to be able to improve patient education so that they'll follow up with their care processes they need to do after that as well. And we're all humans, end of the day, and we all get tired, and AI never gets tired. So a second set of eyes that never gets tired. So I know some of you are skeptical about AI. I know some of you are, we don't know where this is going. If somebody comes on this stage and tells they know where AI is going, they're fooling you, because I also don't know where we are going with this. Nobody knows, it's going so fast. But are there benefits with this? Yes, there's a lot of benefits for the healthcare side. And if you believe, when cars got introduced, everybody's afraid to drive a car. Or when the phones came in, everybody's afraid to use a phone. I believe AI is also a tool like that. We all going to make mistakes, but we all end up using it one way or the other. I think that's what I see AI, especially in this format. So this specific slide talks about, once we have specific algorithms right now, once you get the low-dose CT scan for the cancer, we can actually predict the risk or how the 5-year survival looks, how a 10-year survival looks with these models as well. So from a spot to a clear answer, we can get that. And as I said, we can also use it for patient education. And another thing I want to talk about is diversity. Diversity in terms of training these models. Believe it or not, 60% of the AI models in healthcare are only for a specific population. African Americans were involved in those data collection practices. That means AI is only good for that population. They're not including. So the more inclusive or more able to enroll into clinical trials, that would help some of these models do better for all the populations across as well. So one thing I want to quickly talk about here. So as I said, I'm going to end this here. I have so many talks. So, but yeah, these are the 6 questions that put you in the driver's seat. But I'll be here for the lunchtime here after the Q&A. If you want to see what tools we have, I have the laptop here. If you want to see what AI does, I can show you live here as well after the talk. So thank you for the opportunity. And hopefully I convinced you guys it's OK to have AI in the clinical care because it is needed. So that's all. Thank you. Hold that.